as far as treating varicose vein, the main thing we talk about initially is what takes the place of stripping. So your surface system, you have two large veins. The great saphenous vein that runs along the inseam of your leg.
These are the veins in your leg.
Yeah, and then there's a small saphenous vein that runs along the back of your calf. So those two veins are like the trunk of a tree. So usually in our field, we want to take care of that first. So the options to treat those veins used to be stripping. But now, most or not all of us do the non-invasive procedure, or minimally invasive procedure. They're divided into the thermal ablation and the non-thermal ablation.
So that means you put heat inside.
Yeah, so either heat or no heat.
Right.
So the heat side, we use either intravenous laser ablation.
So that means you're putting a little laser probe inside the vein.
Right. There's a fiber that through a catheter and this works the same way for radio frequency ablation, which is using radio waves to create heat. So they both create heat, and they both are a fiber. So you can't just, it's not like laser from the outside.
So the radio wave is kind of like a microwave.
Right,
Right.
exactly.
Where the small tip of the fiber puts out such a high energy wave off of the tip that it gets hot, just
Right.
like food would get hot inside your microwave.
So yes, we would start
cooking
out cooking the vein. That's what patients
You numb it up, though.
we do numb
You
it, so
it up.
the
So you don't
patient
feel
will feel
That's
so.
your great perspective. Thanks
Yeah.
for adding that.
So
No
all the patients feel is.
And that's what we're seeing right there, right?
Right.
The probe going in.
So that is actually the radio frequency fiber.
Okay.
As you can see, that's the tip of the fiber, and
So there's three parallel lines. The one on the top and the one on the bottom are the walls of the vein.
that's so the white tube-like thing, that's the fiber.
That's
so it's
moving.
inside the vein.
That's
It's inside the vein,
right?
And as when you see that, when I turn it on, that's the steam bubble you're seeing, the cooking the vein, as you say. So that's how that part destroys vein.
So it very carefully burns the inside of the vein so that the vein contracts and shuts off.
It's a very controlled heat, and also before we turn it on, we inject numbing medication, which we call tumescent. All around there is like a sac almost around the vein, so we go into that sac and just pump a numbing medication in there. We pump a lot, so that medicine actually becomes a heat sink. It absorbs the heat, so you don't damage your surrounding tissue, or you would damage your surrounding tissue too.
While at the same time making it totally numb so they don't feel the procedure.
Right. So it does two things. It numbs the vein, and it also serves as a heat sink. So once we turn it on, and then we just pull it out slowly. As we pull it out slowly, we close off those veins. So laser ablation does the same thing too. Laser use heat. It's a fiber. It looks like a fiber optic Christmas tree fiber. So it's, as you see, it just floats in there. You don't feel it floating in there. All you feel is a little needle stick where we numb. The needle we numb with, Gene, you can tell, is the size of a TB syringe needle.
So that's literally the size of the needle that diabetic children use to inject themselves.
Right.
Right. So it's the smallest possible needle in the world that you could really do something with.
Right.
Right.
So those are the main thermal ablation.